This is Samir Qamar. He's you probably saw him earlier. Some of you saw him on Sunday. He runs the MedLion Direct Primary Care Group, which is a pretty interesting group. But while he was working doing primary care and establishing that group across the country, he decided that running a primary care group wasn't enough work, but that he had a problem that he wanted to solve. And it's a problem that we actually mentioned in our very opening remarks that India and I made the other day about getting to what I call that last inch, or maybe it's the last 6 inches for virtual visits. So Sam and his team have created MedWand. It's curing that last inch. It's allowing patients to be examined by providers over the internet anywhere in the world. He believes it's the next, and I think you'll probably agree after you see this, it's the next step in telemedicine. It's turning those video conversations, you remember Aero's bum, as Chelsea Clinton described it earlier, back from Monday afternoon, into a real-time physical examination. So we are thrilled and excited to see Sam show us MedWand right now.
Thank you, Matt. So raise your hand, not doctors, if you absolutely love going to the doctor's office. Yeah, only one hand in that corner there. So imagine if you didn't have to. Imagine if your doctor could come to you by ways of online video chat, but in addition to the video chat, actually examine you in real time. That would be really cool. Let me show you right now. So we're going to switch screens over to Las Vegas, where we have Allison waiting for us, and she hasn't been feeling well, so we're going to see if we can help her from here, all the way in San Jose. Hi, Allison.
Hi, Dr. Q.
So, what's going on?
I have a sore throat, and I had a telemedicine visit last week, but the doctor couldn't see my throat, and I'm getting worse since this visit to Vegas, and I think I might have a fever.
You have the MedWand?
I do.
Okay, if you wouldn't mind, let's take the light part, and if you could shine it into your throat as far as you can so I can take a look. Say ah. Okay, a little bit more. All right, there's a little bit of white light back there, but that's good. You're good, that's great. I want to take a look at your eye too, because I know the right eye was infected last week. Bring it up real nice and close. Great. And I'll also take a look at your left hand, because I remember that you had a rash there as well. Nice and close, looks like it's gone. If you wouldn't mind putting the cone on the MedWand and then putting that into your ear so I can take your temperature real quick. Good. All right. Not a real temperature. And then I'd like you to, let me take a look at your right nostril as well, because you had a nosebleed there last week. All right. A little bit further in. All right, good. No nosebleed, but something else. And if you wouldn't mind just putting that finger into the top part of the MedWand so I can get your pulse oximeter, your oxygen levels, and your heart rate. Just a few seconds. You're a little bit nervous, but that's okay. All right. No, nothing serious. You don't have to worry about anything. I'll follow up with you next week.
Thank you, Dr.
Have fun in Vegas. All right.
Okay.
Okay, bye. So that was just an example with a prototype, what we've done with MedWand. In addition to what we have here, we have a couple of other things. We have a stethoscope at the bottom of the MedWand, which Allison could have used so I could have listened to her heart or her lungs or her belly. We have a 3-lead EKG in case she was having chest pain. I could have seen if she was having something wrong with her heart. And we also have Bluetooth capability to ingest for data from peripheral devices. All for $250. We wanted to make the best tech. We have lots of partners in Silicon Valley who have put some fantastic tech into this, and we wanted to make it affordable for everyone. The use cases are endless. We can now examine patients in mid-flight to tell the pilot if they need to land or not. We can examine patients on ships, on cruise lines. We can examine the aging population in nursing homes, kids in daycare centers, employees at work to keep them at work via digital on-site clinics. And now, of course, we can examine you when you're at home. MedWand doesn't just advance the future of telemedicine, it actually advances the future of medicine. Thank you.